Alberta is reporting its first death from measles since an outbreak of the disease began in the province in March. A baby born prematurely after its mother contracted measles died shortly after birth. While cases in the province have dropped since peaking in July, there have been almost 2,000 confirmed cases of measles this year. For more on this, I'm joined by Dr. Lynora Saxinger. She's an infectious diseases specialist at the University of Alberta, and she joins us now from Edmonton. Dr. Saxinger, what was your reaction to hearing of a premature baby dying of measles in Alberta?
Well, I mean, there's just the human tragedy of it. And as an infectious diseases specialist, I mean, the scale of the outbreak that's been going on in, Ontario and Alberta over the last months is just inconceivable. And in a way, you would expect that we would start to see some severe outcomes at some point, but that doesn't mean that it's okay, because this is, in fact, a preventable death.
A premature baby also died in Ontario. In your view, has the Alberta government done enough to stop the spread of measles?
Well, I mean, I guess I'd argue that any preventable death in a situation where there's a lot of places across Canada that have suboptimal vaccination rates is a big red flag for, all of the governments, that we need to do something differently. I know that the public health people on the ground have been putting in a lot of time trying to contain this outbreak, but measles is a real beast to try to control, and there's a lot of challenges. And so there's, the outbreak control part of it, and then there's also the longer term investment that's needed for public health and for vaccine access, and very, very importantly for public trust. And I think that's an area where we need to see a lot of movement over the next years, because obviously we're kind of heading backwards in terms of vaccine preventable diseases. And there's a really big risk that this could actually happen in other places and with other diseases.
Dr. Saxinger, what is your advice to pregnant women or women who are planning a pregnancy?
And I mean, that distinction is huge, because MMR vaccine or any measles vaccine isn't recommended during pregnancy because it's an incredibly effective vaccine, but it's a live virus vaccine. And so it really is advised that if you could conceive, you should make sure that you've had 2 doses of vaccine. And if you're in a position of being pregnant and being underprotected, the real thing is to look out for risk. And if you are in contact, that be identified as soon as possible, because women can be given prophylaxis with intravenous immune globulin to offer some protection for themselves and for their baby if they get measles exposed during pregnancy. And so that takes a few things. That means that you have to know that you've been exposed and that you have to seek care early. And then a lot of effort will be made to make sure that those women are protected as much as possible.
All right, Dr. Lynora Saxinger, thank you.
Thank you.